And welcome back. Well, since 1980, Neighborhood Self-Help by Older Persons Project, better known as SHOPP, is a not-for-profit multi-service agency that's serving older adults through a full range of community-based services as well as programs, promoting mutual aid within informal support systems and empowering older adults. The organization believes older adults are capable of helping themselves and others improve their capacity to deal with the physical, emotional, social, and financial challenges they face as they age. Joining us now to share more details is the Deputy Director of Neighborhood SHOPP, Tynisha Rodriguez. And Tynisha, good to have you.
Thank you for having me. So happy to be here.
Thank you. So, for somebody who doesn't know, and I can put it, you can put it probably better in layman's terms about the work that you do with Neighborhood SHOPP.
As you mentioned, our mission is pretty much aimed at keeping older adults and caregivers safe, engaged, informed, and supported. We really have been a pillar in the Bronx community for 40 years, something that we really take pride in. We believe in the self-help mutual assistance philosophy, which is translated into 13 different programming, which assists older adults, caregivers, and the disabled of all ages.
And when we talk about programs that you have to offer, I know that there's a variety of programs that you have. And being that caregiver, one of those programs you have is really looking after seniors through friendly visiting. So share with us a little bit about the friendly visiting.
So with our friendly visiting program, we really try um, we've made very diligent efforts to increase our volunteer efforts, and it's attached to our case management program, which deals with a lot of planning and coordination for the homebound elderly. We really try to combat social isolation, in which, especially during COVID, right, whether you had family or not, you were isolated during this pandemic. So we have really increased our volunteer efforts, and we really have been great with that. And in honor of April, it's National Volunteers Month. We were not able to conduct as many wellness calls without our volunteers, and it really has been an all hands on deck for us at SHOPP, which we really are happy about, really
Yeah.
proud of, I should say.
Well, talk to me about the issue when you have seniors, you have those who've been socially isolated, emotionally isolated. But I know that you try to do something in terms of bridging the gap and providing services for that social emotional balance that's much needed, particularly in that demographic.
So, in terms of how we assisted them,
Yeah.
we have made over 60,000 wellness calls and made connections to their medical, to mental health support, and really walk through the journey with them. And really just socialize. It's really an enriched experience for not only for the senior, but also for the volunteer who is very passionate of the well-being of that older adult. It's a weekly call for 1 hour or more. And we have really been able to match over 50 seniors with a volunteer. We really have a great group who are very dedicated and passionate with making sure that our older adults are safe and really engaged and informed. You know, even right now with the vaccinations, providing education is key. And our volunteers help us with that.
So, for those people who don't know, a little bit more about the whole COVID-19. How has it actually affected the work that you do? Because you're providing these services, you're being in touch, you're being connected, but yet and still, we know that COVID-19, it's been a place where we can't do that. So, how have you been able to bridge that gap?
So with SHOPP, since the start of the pandemic, we had to pivot from in-person service delivery to remote services. So our frontline workers had to immediately develop strategies to engage and train seniors on technology. So SHOPP developed an agency-wide platform known as SHOPP Virtual Connections. So if we offer, let's say, a health and wellness virtual programming from one of our older adult centers, we then share that programming with, let's say, the homebound elderly, in which we normally wouldn't have done if we were providing in-person services, because you would have had to be known to either program. We had to really, you know, conduct surveys and identify the needs and look for grants. Right now, we're able to provide tablets with a data plan, and we're really trying to capture as many seniors as we did providing in service. We're trying to capture anyone in the Bronx, I should say, and keeping them engaged, because that's what we're about. It has not been easy. We also had to address food insecurity. So right now we've partnered with the Farm Share Common Pantry, which is delivering local produce to one of the developments where one of our older adult centers is located. And again, we had to address the whole social isolation, in which, again, it has really been all hands on deck. And right now, our older adult senior centers have been hosting vaccination sites. We're trying to get as many people vaccinated so that we can go back to whatever our new normal is.
Yeah. I know that you rely a lot and heavily on the work of volunteers. You talked about those volunteer calls. How does a person get themselves involved as a volunteer, and what's required?
So you have to be 18 years and older. And there is a background check. However, right now, because SHOPP is 100% remote, right now it's just weekly calls. So if anyone is interested, I would encourage them to visit our website at www.nshop.org, and you would find the application. And you would find more information of how to apply, but we certainly we need as many volunteers as we can. We believe it takes a village, and it's a very vital service. And again, right now it's usually done in person. It was an actual visiting program. However, right now we continue to operate remotely, where it's just 2 calls a month would really brighten the life of an older adult. And it's such an enriching experience. I can't express that enough.
And so I want to get, before we get out of here, get an opportunity to share with our viewers a little bit about New York Connects. I don't want to let this segment leave without you having an opportunity to talk.
Great. So New York Connects is a state-funded program, which I like to call that trusted place where it would assist you with finding long-term care information. So it's pretty much it serves as a single point of entry for long-term care for the disabled of all ages. And it's, think of city and state complex systems where a lot of people hit a roadblock, or you hit a busy signal, or, it just gets so frustrating where you give up. With this vital program to the community, you will be assigned to a trained specialist who is willing to hear what the issue is and would, provide the necessary assistance and would follow through. We would not just provide information, not making sure that there's an actual connection. So it is a state-funded program, and it's your go-to place to find long-term care information, where it's not just for the disabled of all ages. We welcome professionals looking for community resources. We really want to bridge that gap and keep the community informed. Not a lot of older adults and their families know about what they're eligible for. This is that place where, even if you just have a question, that I would welcome anyone to call.
Tynisha, we got to leave it there, but thank you so much for being with us here on the show and sharing a little bit about the work that you guys are doing. Certainly, in providing services to the most vulnerable population is very needed in this society and this time, and you guys are doing it. Thank you so much.
Thank you for having me.
All righty, now for more information, we encourage you to visit their website. And after you visit their website, go ahead and find out all that you need. We're taking a quick break. We'll be back with more show coming up right after this.